All right.
I got there.
Let's start again. So,
like we were in cannabis and not IT, eh?
guys, thanks so much for making the time to connect. I really do appreciate it. I know that you're all busy and running some really impressive companies. So, what I wanted to do today was have a chat with you about what's going on from a commercial perspective across Australia and New Zealand. I should note that Paul from Helios won't be able to join us today. Unfortunately, he's got some personal matters that he needs to tend to. Wishing him all the best. But to jump in, I always like to ask the question to my guests, what are they most excited about in the cannabis industry and why? So, perhaps you want to jump in and start with giving us an update on what's exciting you today with the work that you're doing in the cannabis space and why are you excited about it?
I think probably the thing that excites me the most is probably also the thing that actually creates the most issues, and that's the fact that the landscape is moving so quickly. Myself and my business personally, we like challenges. We've faced many of them, as many companies in the cannabis space have. But I think our pivot specifically in this space, we look at the early entrant companies focused on biomass, API, and then a lot of companies couldn't focus on that downstream format. This year specifically, when we looked at our TGA audits, we looked at really focusing on being able to take the API and then turn it into those downstream formats. Like obviously everyone's doing tissue bottles, everyone's looking at other different means to get the product out there, but being able to potentially do the first sort of production or commercial batches of vape pens, commercial batches of topicals and all the downstream formats is exciting for us, but it's also a challenge because you've got to do them quickly, be a first mover, but that creates a lot of challenges trying to do that.
Yeah, okay. So Guy and Mark, you guys, Mark, you're at Cannasouth playing a supplier role. You guys are moving product into market. What excites you given the kind of opportunities that are currently going on in New Zealand? There's a first to market opportunity right now, given the registration process for products. What's currently exciting you at Cannasouth right now, given the status of the New Zealand market?
Look, I think just getting the market going down here, we've obviously sat back and watched what's happened globally and been able to learn a lot of valuable lessons, from what's happened around the world, different company strategies. The excitement down here is, from patients and people that are wanting to be involved in the industry is pretty remarkable. And so, we try and set ourselves as a leader, and we're obviously the first company down here to list on the NZX, and that carries a bit of mana with it and a lot of responsibility as well. So, we're going through all the same challenges that, that other companies in more mature markets have been through. But like I say, hopefully trying to learn a few of the lessons. And, we're attracting some amazing talent, people that are passionate about the sector. These are not what, people imagine cannabis people to be. These are, really professional, dedicated people that are just focused on delivering medicines to patients. Everybody can see the potential of medicinal cannabis, So really just building a team, building a business, as Warren said, really, you better have a plan for, a strategy of differentiation. Otherwise, it's a commodity game. And so, again, harnessing innovation and, trying to find your point of difference. So big challenge, but lots of fun.
Yeah, 100%. And there's a couple of questions I'm going to probe you on in a moment, but Guy, I'll jump to you now because, I really like what you guys are doing at CDA. I've actually been tracking your journey from day dot, where you guys started with Burley. You had the hemp play as well. You opened up your clinics. You guys have expanded quite quickly in a number of different areas. So same question to you. What's exciting you right now, given the kind of diversity of what your business is focusing on in the cannabis space?
Yeah, the business side is always exciting in regards to the growth, especially the unknowns. Things are changing so quickly, so you've got to adapt and innovate. But recently I've been reinvigorated and getting more excited about the benefits our patients are seeing. So we share these in-house, some patient stories, and yesterday I got 3 or 4 stories come to me that it's life-changing. people that have come to the end of their options and treatment that they're currently using or doing and not getting relief, and then finding that with the new medicines that are coming out, natural medicines. So that's probably the most exciting part for me right now, is just continuing to see that, because that's what we're all in it for, and to see that happening is really special and really exciting.
Last week I spoke with a New Zealand regulatory consultant, and she was saying what she really respects is that there's a lot of entrepreneurs that have entered this space. I myself, and I know Warren, did not necessarily have a pharmaceutical background. What have you guys learned in the last 12 months working in this pharmaceutical market? What is some of the key kind of insights that you've gained working in a new entrepreneurial industry that is very pharmaceutical focused? And that's open to any.
For me, I think that not coming from a pharmaceutical background has been beneficial, because there's no predetermined way of doing things. We do things the way we do it, and it works. We've learned, obviously, what's required with all the legislation. We know that. We've been doing it a while now, but not having that background maybe brings a different way of looking at it. And that's how we began the clinics that way. We knew what needed to be done. We knew what people were looking for, and developed it in our own way. But yeah, along the way, bucket loads of learnings, bucket loads of it goes on and on. It's every day. We're still learning today, yesterday, tomorrow. So it's been a good journey.
On that note, though, as a quick question, follow up to that, guy, is that, what are some of the challenges then around that, given that you guys operate across the entire of Australia? You guys have to deal with multiple jurisdictions of regulation. I'd imagine it's going to be much simpler. No, I wouldn't say simpler in New Zealand, but New Zealand it's one framework, whereas each state treats cannabis somewhat differently. Does that pose challenges to your business operating as a clinic that sells and distributes product across Australia?
No, not at this stage. We do our research. We know what we can and can't do. As long as you work within the guidelines and the rules that are out there, you'll be fine. So doing your research and putting time into that is key. Sometimes you might find something you can do without knowing it by reading the legislation. There might be a hole somewhere or a way it's worded that you can do certain things, or states are different. You've got state level and federal level, so not understanding the entire system and then working backwards is key. So definitely doing your research.
Okay, so yeah, I can appreciate that. I mean, MediPharm have gone through several challenges operating, through the federal and the local legislation. Do you have any kind of key learnings that you can draw upon from, operating something which didn't exist before and building out a GMP facility? You often say that you used to have hair at the beginning of this journey, and now you don't. What's one of the
Still can hold the room.
Still can hold the room, but what's something that you've learned? What's one of the key lessons that you've learned in the last 12 months in particular? You've gone through a full GMP audit in 12 months. What's one of the key insights that you've learned operating in the space through those lessons?
Yeah, so the first thing is, I think not coming from pharmaceutical actually makes you probably, the word I would like to use, maybe more nimble, more malleable, more accepting. But I'd like to say that if I hadn't known up front all the different things that I were required to get through to where we were today, I probably wouldn't have done it. Simple as that. But the reality is you always have this, and everyone has it. Like in New Zealand, I can imagine you're in this phase of everyone saying, oh yeah, we're going to be out the gate manufacturing products under GMP in the next 2 months. I'm like, well, guys, I started the journey at the start of 2017, and we're at the end of 2020 now, and we're finally manufacturing products. But the ability to be malleable, adaptable, and not be stuck so rigid, because the cannabis space is so nascent, because the regulations are not necessarily fully formatted. We're asking questions all the time of the TGA about how we should do this, what's the expectations here, and we're the first ones to ask the question. And so then that sense you're actually crafting the legislation as you go along, because you're setting the precedent before that. So that makes it great. You have to have a lot of drive, and I'm not saying, like Guy just said it, every day. I've got a diary of what my expectations are of the day of meetings I'm turning up to, but I'm telling you right now, my day, forget about it, because every day is absolutely different. There's new curveballs coming through every moment, but that also makes it extremely exciting. But as you've also said, Guy said, and actual Mark said as well, you need a really good team. You need people who are nimble enough, and also understand, coming from pharmaceutical individuals are used to being potentially doing this one task day in, day out. My entire team needs to know everything from regs to quality to production. You know, we have people doing shifts, doing labeling, boxing, packaging up products, and we'll continue to do that. Everyone needs to be nimble enough to do many things, and that team factor is critical to the success of the business 100%.
Yeah, fully appreciate that. And then I guess that gives me a bit of a segue to yourself, Mark. What you guys are trailblazing in New Zealand, what are one of the challenges that you have faced in the last few months, given that this New Zealand framework didn't exist before? Now they've implemented, they gave it a time frame of October for all product to be GMP. There's not many companies across the globe that can provide that. So there's still product in market that is non-GMP that's going out to patients. What are the challenges that you're, as a business, currently facing, given this kind of uncharted territory that you're currently trailblazing through?
Oh, listen, I think Warren and Guy just summed it up perfectly. You know, we're all in the same game, and the regulators are learning, we're learning. You know, there's just challenges, you know, when you're trying to do a full vertical integration model, you know, from cultivation through to medicine manufacture, it's just unbelievable. And so, you know, I'm the same, not from a pharmaceutical background, but we've got some amazing people with pharma backgrounds within the business. And a lot of them have come from big pharma and have got stuck, or, you know, got sick of the regimented, can't change focus, very siloed approaches, lack of innovation, and so wanted to come to a new space where you can look at things differently. Yes, you've got to operate to those strict pharmaceutical standards and understand, you know, how these systems operate, but challenge the systems. Warren summed it up. You know, the regulators want us to go and talk to them and ask the questions, because without that, they don't know either, because this is fresh ground for them too. So it's having that collaborative approach, and basically, again, the entrepreneurial sort of spirit of just get in there and just get it done. You know, there's no other option. We just got to get in there and get it done. Be collaborative, be positive, and push on through, and realize what it's all about. Ultimately, we're opening up a whole new area of medicine. You know, well, it's not new, but we're bringing it back, and we're going to, you know, make the most of it this time. So, you know, exciting challenges just don't stop. You know, as Warren said, you just get up in the morning and you just roll with it. You know, and you better just one thing I've learned from being in business for many years, I describe it as like standing in the surf. You know, the wave comes, bang. You know, next minute another one comes. So you better just get used to the waves, because that's what it's like. You know, so it's look, I love it. It's great. It's amazing.
Yeah, I can appreciate that. I mean, New Zealand's an interesting one because, again, they've taken such a more liberal approach to cannabis reform. And I guess, Guy, I'm interested in your perspective on this, because you're in a space where you need to apply for a granting of access to medicine on a case-by-case basis, unless you're an authorized prescriber. I'm interested to kind of get both your perspectives on the prescribing schemes, because in New Zealand, you've got discretionary prescribing. Any doctor can write a prescription, which is incredibly liberating because it allows for a bottleneck to be removed across the entire industry. Whereas in Australia, it's the opposite. You've got to get a case-by-case approval. I guess, where are the benefits for your company, Mark, and for Cannasouth's perspective, is how are you leveraging this accessibility piece from a doctor's perspective? And Guy, how have you been able to make the best of a bad situation with CDA? So in the sense of that there's a lot of man hours that are invested into putting in these applications. and a lot of reporting. So I guess, Mark, where are the benefits and what are you guys doing to innovate in that space? And Guy, how have you addressed that as a challenge through CDA, this approval-based system that the Australian government has implemented?
So I guess, yeah, from our perspective, yeah, it is much cleaner in that regard, but we're still faced with the same problem, and that is prescriber resistance and lack of education. So at the end of the day, you can have it the easiest system in the world. If the doctor is not confident or doesn't have the knowledge to prescribe these medicines, it doesn't really make a difference. So, you know, that's a big challenge. And so, you know, look, I think it's likely we're already starting to see the clinic, you know, specialist cannabis clinic model in New Zealand start to appear. So I imagine that's probably going to be, you know, quite, you know, similar to Australia. This is the sort of traditional GPs will refer a patient to a specialist cannabis clinic. They understand the medicines, they see the results, and then slowly from there, over years, you'll start to find it being more prescribed by the regular, you know, medical fraternity. But you know, it's the education thing that's the challenge. So certainly that's a big plus, but you know, I don't think the floodgates are opening anytime soon. It's going to be a process to get there.
And you can't market, can you, in New Zealand? There's no marketing of the products. Yeah.
No, Section 29 is pretty cutthroat. You know, basically you can't talk about a product. You know, that's it. Someone asks you about it, you can, you know, we can tell the prescribers about it, but we can't sort of go out and actively market it. So, you know, so there's trade-offs, you know, there's positives in some area and big restrictions in others. So, but look, this is you know, we talk about, you know, it's a marathon and not a sprint. You know, this is going to play out over years. This is not just a flash in the pan, you know, so you just got to be prepared for, you know, the long game.
So Guy, on your end, you guys are moving thousands of products a month. How have you got around this? How have you addressed this bottleneck issue of this case-by-case prescribing system?
I guess it's not really the case of getting around it. We've been doing this a long time. We still use SASB pathway. Our doctors are authorized prescribers for a number of products also, but if the doctor feels the patient needs a certain product or will be right for them, we still do TGA approvals. It's just about the education. So as I was saying, our doctors have been doing a long time. The approvals is just another bit of paperwork for them. For the new doctors out there, it's a bit more daunting. So in that regard, we've actually created a electronic SASB submission form where it auto-populates a lot of the information, helps them out through the process. But it's there for a reason. As Mark alluded to, it's a marathon. They're not going to bring in a new scheme into the country and let it necessarily be just go out there and prescribe. They'll most likely strip things back as they go. For the TGA to be able to oversee tens of thousands of patients being approved over a period, it's just going to get too much, I think, and then they will look at maybe easing things, in my opinion. But in this stage, we just do it. It's part of the service we offer. The patient comes to see us, they pay a fee, and that's what they're getting, whatever they require. So it's just something that we have to live with and educate other doctors and train them through the process if they want to get involved as well.
Yeah, indeed. And Warren, how does this impact, I mean, as a manufacturer, how does this impact your business strategy, considering that there's only a certain amount of product that can move throughout Australia per year? What have you guys done at MediPharm to account for this? What's the strategy that allows MediPharm to keep the manufacturing facility operating?
We're wholeheartedly focused on manufacturing products for every geographic location globally, because if we're relying on regulations to change, we're going to have a very tough slog to do so. We get involved in lobbying in certain areas. Like I think there's something we're going through at the moment as a business, and that's lobbying to actually make it harder for products to arrive, say for example, into Australia that are non-GMP. But lobbying things like changing to SASB applications is not our game, because we're not prescribing products. We're really a wholesale distributor of products, and so our business model and business development team are up late at night, up early in the morning, talking to companies all over the world, and we'll see markets evolve and mature and deregulate, deschedule over time, and we'll be there already having hopefully lots of products in market as things become more free to do so.
Okay. I mean, that makes sense. Ultimately, Australia is also the launch pad to Asia Pacific, which is a significant opportunity, which, you know, we're a few years away from seeing that. South Korea has allowed for importation, but only of registered products, but that might change in the next year. You've got Japan allowing CBD, Thailand is opening up. I think there's also going to be a lot of local opportunity, not local, but opportunity across Asia Pacific. I'm interested to understand, I guess, considering that each of your businesses are very different, Mark being, you know, right now is mainly acting as a supplier, with your vertical integrated focus, but focusing on the supplier aspect, Guy focusing on distribution and prescribing and more on manufacturing. What are some of the biggest threats that currently face your specific section of the industry today? And how are you defending yourself against those threats?
So starting with me.
Anyone who wants to take the floor.
Yeah, all right. Well, I mean, I guess ultimately, as I said before, if you're just relying on basic tinctures, blends of CBD and THC in a bottle to be your product strategy, then, you know, you better either be producing it incredibly cheap, or, you know, so ultimately the biggest challenge is getting away from that area and getting some product differentiation, you know. So, you know, that's what we think about a lot. You know, how do we leapfrog or come up with that? You know, Warren alluded to it earlier as well, and everybody is thinking about it. But you know, pharmaceutical development, thinking about novel areas, whether you can target where maybe not everybody else is headed for. You know, so that's what we're focused on. Of course, you need to build a machine that's able to deliver high quality product at a good production price point. But you know, again, a lot of the business models are the same. So you've just got to, you know, be thinking innovation and, you know, trying to come up with something a bit unique. So yeah, that's what we spend a lot of time thinking about for sure. But again, looking for partnerships as well. A lot of times in the pharmaceutical world, you know, you don't have to necessarily take on every region of the world yourself. You work with partnerships like we're doing currently with MediPharm as well. So, you know, you look for win-win situations and build good relationships and do good business. And so that's, you know, that's what we're looking for as well.
Oh, for me, yeah, Mark nailed it. Innovation and keyword doing good business. If you operate in the industry, you know, honestly, with integrity, things are going to go well. You might look at our business as two parts and say clinics and distribution. Obviously, there's to maintain helping patients, you have to be sustainable. You have to be a business at this stage. You might say that other clinics would be our competitors and other distributors would be our competitors on the other side. We innovated. We sat down a while back and thought about it and thought, you know, there's going to be a lot of products coming into the market here. What do we do? At the moment, they're our competitors, but how do we make them not our competitors? And that's where CamView, our marketplace, was born. We thought that at the moment it's addressing both of those risks. Other clinics and doctors are using that for prescribing, and we're also distributing from 15 companies now. So instead of them competing against us, we said let's work together, and you know, it's working well. So at this stage, that's probably our biggest thing in the last 6 months, I could say, to address those concerns. It's going great, but just continuing to innovate technology, making things easier, making processes easier for all the stakeholders involved, whether that be doctors, pharmacists, patients, is key. Being different.
Yeah.
Just to put a flag there for a moment before we go to Woz, you've got 15 products on. How quickly did those 15 products come on board, and do you see that number growing over the coming months? I believe there was a report recently released that they said there's 150 products on market now. Yeah, how quickly has that number grown on your platform of the products that are available?
Yeah, it's 15 companies. We've got 70 plus SKUs that we distribute. So probably half, you could say half of what's available in Australia. That 150 products that they do mention, I am of the belief that they are TGO 93 declarations have been submitted, but they may not necessarily be being used. So it's hard to say the exact number, but we've been approached by a number of other companies that are wanting to get involved. So that's, you know, it's just, it could go higher, but we want to keep it with a select few of trusted companies at the moment and grow that base. But I see over the next, I say this quite candidly sometimes, that 2021 I see as being battle of the brands. Everybody's coming out with a brand of product. Most of the formulations and products are very similar, so the differentiation is yet to be seen of how they're going to, I guess, compete against each other as a branded product. We're still going to sit there as a distributor and help that, but at a product level, it's going to be interesting what happens moving forward.
If you were going to, Warren, this is also a question for you. If you were going to give a new company advice on how to differentiate their brand, what would the one piece of advice be? If you could choose any piece of advice, what would that one piece of advice be? Warren as a manufacturer and Guy as a distributor, what would that advice look like?
You go, Warren.
Okay, so I'll answer the first question. So our biggest challenge will be quality, first off. People don't understand a lot. If you go overseas, a lot of it actually, the definition of GMP is so broad, and people do not get that. Right? Like these headphones could be GMP. You know, and that factor alone is just boggles me, and probably my biggest learning. But product quality will be one of the first things from my perspective that I'll flag is the biggest challenge, and that's something that needs to be fixed. New Zealand's done a tremendous job in their framework from my perspective and how they've evolved it. And I think that's something that you know, countries like Australia and the TGA should reflect on, even though the TGA bestowed a lot of information to New Zealand around how they should establish their framework. Germany's done the same. There's a lot of rigor around products in those countries. Now, from our perspective, we look at, you know, let's say product arrives in Australia. As a manufacturer, if that product has an API format or something we can use, we do an audit trail of that company to understand whether that product material will be something we could use ourselves, only to find the product arriving and the website that the company's, you know, portraying has GMP written all over it, but nowhere through the supply chain is that company at all GMP. And that factor is really going to hurt the industry. It's also going to be impactful to patients, and there's high risk there. So that first factor around quality and those types of items are important. And ensuring that the second part is you know, the SASB application framework and CDA, you guys understand cannabis, so it's great. But let's say we have the OTC evolution on CBD, you know, there's an efficacy conversation that we need to have as well, because patients consuming cannabis, you know, you take it 2 or 3 times and it doesn't work. I'm not saying cannabis works for everybody, but you're receiving a product that doesn't necessarily have efficacy around it. There's a real risk that we have a lot of people to turn from cannabis because it's not treating them for the symptoms they should be treated for. So there needs to be a real understanding of the quality, the content, the potency, the symptom, the treatment, and people need to really understand cannabis to drive into what that person's challenged by and create or give them the opportunity to get the treatment that they desire or that they need for that particular symptom. Otherwise, we have a risk of CBD coming into country like it is in the US. It's hemp derived, and God forbid, who knows what it's going to do for anybody at all over time. And those are the 2 risks. In terms of differentiation, I think we've all nailed it already. I think it's being able to be unique, different. I think that yeah, in Canada, it's evolved slowly, but you're looking at those types of formulations that are targeting to specific entourage effects, and that's sort of moving, I guess, into more of a recreational style statement, but it's still that could lend itself very much to a medical market for sure.
Well, I'm gonna jump a few steps forward because I mean, sorry, Guy, I didn't let you finish there. Do you want to add on to what Warren said there about differentiation and your advice piece there before I talk about use cannabis?
Yeah, just quickly. Right now, I get asked this question a lot. It's a hard one. Right now, I would say Australian grown, Australian made would be a key one, which leads into quality, as Warren was saying, and the other one would be reliability. Especially during COVID, there's been a lot of reliability issues with many products. That not only frustrates doctors, that frustrates patients. You want someone to believe in your brand. Having it there when they need it is key.
Yeah.
Are there much shortages in that you're seeing through CDA? And then Mark, I'd love to understand what the shortage situation in New Zealand looks like. What is the shortage situation that you're seeing through the clinics? How often are brands running out of product?
Over the last few months, it was a real, it wasn't good. Different companies, different brands. That was mainly due to COVID, at the early stages of COVID, and then a bit of a lag. But I see the next couple of months or the next month or so, it should get back to normal.
And do you think that's due to poor planning? Is it the supply chain where the products were being imported from? What's the key issue there around this drop in product?
A few key points that we've seen, whether, say, if it was Canadian product, their permitting on the Canadian side pushed out to 10 weeks, as far as I'm aware, from 4 weeks. Flights getting cancelled. Obviously, there's minimal flights going at the moment, but I've heard of flights being cancelled last minute and then having to get another one a week later, that being cancelled, another one a week later. Quarantine in Australia has been holding up certain companies' products. It's many things. I think a lot of it does lead into COVID, though, unfortunately. But as I was saying, I think we've seen the tail end of it.
Mark, what about New Zealand? Has there been any supply shortages on that side of the pond?
Well, look, you hear anecdotally about various, we're obviously not on the front line of, selling products at the moment. So I think the whole runway, with the 1st of October being the point in which products were, meant to be phased out, has been probably caused a few issues with importers all of a sudden, trying to get product, assessed, and they're not being able to meet the quality standards. So that's been pushed out now until the 31st of March. So that's probably caused a bit of confusion. But yeah, look, it's again, we're not the THC products we're not really seeing here yet, and getting these products assessed and meeting the New Zealand quality standards, as Warren pointed out. The rubber hits the road when you've actually got to look at these quality standards and meet them, But having said that, the regulators are, they want to see these products, get through the system and be available to patients. And so you've just got to put your best foot forward. You've got to have a good argument for exactly what you're doing. And, because it's not clear cut with a lot of these things. These are all new medicines that they're having to evaluate. So, so we're obviously doing that as fast as we can, and patients are desperate to have access to a better range of products. And I know the clinics that are available here are crying out for it as well. So, definitely lots of challenges, but, just got to thread the needle, right?
Yeah, indeed. Did you want to comment on that, Was? Anything else you want to add? So
I got it. Sorry, I got a quick one there. One other one that's a big one that's happening is companies are planning their stock, and they're actually in Australia, especially, we're just seeing patient numbers skyrocketing. Now, you wouldn't, whether you say that's poor planning or not, some companies want to not order too much and have to destroy product, etc. But the demand is growing so fast that some people aren't keeping up. It's a good.
I've got a full vault. I'm telling you right now. My email address in the bottom there, and I send it across the phone to Adam, and you can just get off there and start making some phone calls.
A lot of this is other companies where it's specific SaaS-Bs, and they're on that product, and patients are just coming back and then telling their friends, and then they're getting it. So it's just another issue. So rapid growth, you could put it down to.
Yeah, I mean that's an interesting one on the rapid growth piece, because it has grown a lot quicker, and I think that bottleneck was the clinic piece and the general receptivity of doctors, and now these clinics are starting to grow. And a number of these, like Guy, your business has grown exponentially since you launched it, so I think that allows you guys to process more patients and the wait times decreased. But on the supply piece, I mean, yeah, that's my biggest concern is the medicine being available one day and then not being available another day. But on that 12-month destruction note, interestingly enough, if your product's manufactured in Australia, you don't need to destroy it after 12 months. So that's a leverage piece that MediPharm has. Not to plug MediPharm here, but the truth is the benefit of any local manufacturer can then have the product created and not destroyed after 12 months. So that shouldn't be an excuse for much longer then. It shouldn't be an excuse at all. And I think that's where the self-sufficiency of a local industry is absolutely essential. And I think that's where, I guess one of my kind of pivots here is around political challenges. So Warren, I know you've got a pet passion here, and maybe you can speak about this. And what are some of the key political issues that are currently being faced by your businesses? And Mark, I'm particularly interested to hear your answer because I'm not sure what that looks like in New Zealand, but I certainly know what Warren's going to say here.
Well, I mean, first off, I think in 2016 you deploy an industry similar to New Zealand, and like Mark said, you need partners, and I think the partnerships can evolve. Maybe it's initially supply, but then it's also working together on different formats and actually creating a New Zealand orientated finished product, for example. But that element of allowing, say, industry or companies to drive product into market should be only there to satisfy that early phase from my perspective, because if there's a local industry that can provide the same product at that quality standard that's met under the regiment of the jurisdiction and the regulatory framework to which they operate in, countries need to have a consideration and support the industry to which they've all broadcasted their own political agendas over creating a consideration that this country is going to be the biggest, one of the biggest distributors of products globally. Well, you have to support the local industry at the same time. Now, it has to go hand in hand with, as Guy said, availability of products. We can't have a challenge where CanView is lacking product availability because the patient increase in numbers are there. But I'd say that the ship has completely sailed with manufacturing and companies who can create products in Australia today, that we're no longer in 2016, we're about to turn into 2021, and we need to look after the local industry. So that's a big push for me. And I think that there's the sort of general straight back responses that come back to that. But I think we're starting slowly but surely. I think you'll see in early 2021, and actually we just got some recent feedback from the TGA that in the start of the 2021, there's going to be a complete review of the import of products, not just products arrival and testing on arrival, which I'll argue till I'm blue in the face that is the appropriate approach. Yes, it'll give a point in time view of that particular product's quality, but you can't test quality into product, simple as that. So the framework needs to be reviewed, and that review process through a lot of influence, not just from ourselves, but the industry, will hopefully then have a self-supporting nature to it, to help ensure the continuity of this industry for the future. Because as Mark said, guys, the industry's small now, as big as we believe it is now, and the increasing numbers through CanView and these other platforms for patients, it's a drop in the ocean compared to where it's going to be next year, the year after that, and the year after that. So we need to be supporting our industry through that evolution as well.
Yeah, nicely said. Mark, what about on your end? What are some of the kind of political issues or political challenges that are currently being faced by your company in New Zealand? Is there anything in particular that stands out?
Well, not so much politically. I think politically the will is behind medicinal cannabis. The regulators are supportive of it. In fact, we've been obviously operating in the space since 2015, 2016, starting to look for research licenses, and in more recent times, as the scheme has evolved, the regulators have been actively engaged. We're involved with the New Zealand Medical Cannabis Council, which has got probably most of the main players down here. And the regulators they want to engage with us, and it's a positive engagement. They want to help us. They're not, put it this way, they're not putting any roadblocks deliberately in our way. They've set the quality standards, and yeah, when you roll out regulations really fast, they're not necessarily always going to be, right. But at the end of the day, I don't think there's any of the roadblocks that exist have been put there intentionally, and where they are just a byproduct of poor, you know, or a lack of time in crafting those regulations. They're keen to see how we can work through them, you know. So, you know, that's pretty positive. I think politically, obviously, we're all aware that there's a referendum coming up very shortly here regards adult use cannabis. I think as an industry and as a company, we're really keen to see that referendum decided one way or the other. The uncertainty is not great. People are confused down here. They don't know. A lot of people don't think the medicinal cannabis scheme is even in force yet. A lot of people think, oh, you know, a company like Cannasouth needs the referendum to go through for us to actually exist as a business, you know. So we're going to be pretty pleased to get through the uncertainty. And but generally, politically, as I say, the will is behind medicinal cannabis. The regulators are supportive of what we're doing, and so I think we just need to represent the industry and set really, really high standards, which we're certainly trying to do, you know.
Yeah, I completely appreciate that. I mean, it's honestly, it's like a crystal ball piece. You know, we were in the same position that you were in a few years ago when the first Cannabis Council was started. And now, you know, there's a much bigger push from companies and these industry associations to kind of rectify certain challenges that were initially implemented for a specific purpose, say, to allow for the importation of product, which are now somewhat, one could argue, damaging the industry, because you've got, and this is, I mean, an interesting question for you, Guy, in particular, because ultimately you've got exposure to a lot of products that are coming into Australia, but, you know, there are going to be countries like Colombia and the Kingdom of Lesotho, these countries where labor is cheap. The pharmaceutical industry isn't necessarily as established as Australia, but the product still can get into the country here, whereas New Zealand, it won't happen. How do you see that affecting your business, Guy and Warren? Guy, you can take the floor first.
How do I see the cheap products coming in affecting our business?
Yeah, the fact that, you know, you've got a quality standard that you want to have instituted on your site. You've got particular vendors that you're looking to deal with. And then there are going to be potentially more floods of products coming in from other countries as they have their cannabis framework either developed and institutionalized and their industry operational. How does that impact your clients who, you know, are building their brands today, but then might be competing with, you know, quality products that aren't operating on the same quality, but get in because they adhere to TGO 93, but they're also much cheaper and affordable, but they still don't, you know, that quality piece, as Warren said, you can't build quality into the product, but they're still available. So how does that impact your clients and how does that impact your business?
When I say the market, I'm talking about the patients, the doctors. I think the market will dictate that. I think that these products will speak for themselves. You could say they're cheap for a reason. We want to work with quality producers. As I was saying, Australian grown, Australian made is key. And I think that the patients will drive that. I think the doctors will drive that. I don't think it's up to us as a business to dictate what happens there. I think the patients will do that, and it will be clear. Patients are very vocal. There's lots of support groups out there. There's lots of word of mouth. Most of the business and interest we're seeing in our company is word of mouth. So word of mouth is huge in this industry at the moment. We did have one line of products that was getting some feedback, good and bad. By bad, not the best. So we discontinued those working with that company to keep the quality high. We listen to the market. We listen to the patients and what they're looking for, what they want, and what they expect is probably the better word to put. There's a very high expectation for the products, and it's our job to meet that. And I think that will work itself out.
Yeah, indeed. Warren, what about your thoughts? I mean, you guys, MediPharm has the opportunity to source material from these various suppliers, but at the same time, they can act as competition. How does this affect the business? How do you kind of think your way through this to ensure that MediPharm still stays competitive?
Oh, I think we operate in the most prestigious market in the world for pharmaceutical manufacturing between Australia and New Zealand. That's the TGA GMP framework, and so we, as I said, that's why we're lobbying. I think that, you know, there's, as Mark alluded to before, those who make the regulations don't fully understand cannabis. Even in the TGA today, they don't understand it. And that, so from that element, if there's the element of education, but it's also about ensuring that you can articulate the difference between the two. But I think you'll see that's already sort of happening. While there is South America, there's, you know, obviously the increase in companies in Southeast Asia, etc. There's a lot of companies who are divesting away from their opportunities in Lesotho and other parts of the world because, you know, their regulatory frameworks don't meet their mutual recognition agreements to get their products into other countries, and that's more difficult. And so what we see now, even from our own perspective, is we got, you know, where if you look at our supply pathways, like 80% of our revenue next year will come from clients in Germany, UK, and Europe, and these are, you know, this is a high-end pharmaceutical market, and you know, there's going to be a well-trodden path between Australia, New Zealand, and Europe, and Australia, New Zealand, and Asia, and that's because of the credibility, the quality, and those sort of factors around that pharmaceutical lens. But I guess where it becomes muddy is probably that recreational angle and how it's regulated, and how they really still continue to ensure that products meet that same quality standard if it is a recreational market versus a pharmaceutical market. But we no matter whether it's recreational, pharmaceutical, we still bestow ourselves around that standard, and that standard is what we call gold class, world class, and we're happy to continue to fight on that factor and lobby for the fact, and also prove the product quality through everything from stability, shelf life, Guy's feedback and his group's feedback through patient, you know, patient out data, all those types of things.
Yeah, I think that's a really interesting point though on the adult use topic, and I'm particularly interested in, you know, all of your feedback on this because, you know, Market's quite close to home, and obviously Guy and Warren operating in Australia, where, you know, if the New Zealand referendum is proven, adult use market is implemented, what do you think the implications are for Australia and New Zealand if adult use cannabis was made available in New Zealand? Mark, you might want to lead that because you're closer to home, but I'd really be interested to hear the Australian panelists' perspective on this.
Yeah, look, it's the $1 million question. If there's one question I get asked, you know, 4 times a day, every, you know, it's a really interesting, and as I say, I'm keen for the referendum result to come through, so we've just got some certainty. But look, it'll muddy the waters, absolutely, if there's a yes vote. There's no denying it. You know, you've got this unique situation where CBD is a medicine now, and so if you've got an adult use market and you've got products that have got flower and it's got CBD in it, you know, you've got all these weird things that are going to have to be dealt with. You know, a lot of people say if there's an adult use market, that'll be the end for medicinal cannabis. Everybody will just grow it themselves and make their own medicines. Well, look, people are accessing black market cannabis right now to make very basic tinctures and oils, and you don't get that pharmaceutical consistency. You know, we believe in the full potential, and we're only just scratching the surface of the potential of medicinal cannabis. So, you know, to target specific conditions in the long term. So we believe medicinal cannabis in its pharmaceutical quality level has got a long-term future, regardless of an adult use vote. You know, obviously the wellness sector is a big sector which could be opened up if there's a yes vote in the referendum, which, you know, is really interesting. So any relaxing of some of the non-psychoactive cannabinoids and how they can be used in a wellness and nutraceutical sector is pretty exciting. But as I say, equally the status quo, massive potential for full pharmaceutical development. So, you know, for us, it's almost a 50-50, you know. A no vote means that, you know, there's a lot clearer air for full pharmaceutical development of, you know, high quality medicines. So that's great. You know, a yes vote, well, there's still that same ability longer term, but there's potentially some other areas in the wellness sector that could be really interesting. So I think certainty is what we really want. And then, you know, as a business, we'll plot our course once we've got that certainty.
Yeah, it's a fair point. And I also think that my concern was initially that patients would migrate from the from the medical market to the recreational, the adult use market, and then there's a lot of data that you'll lose from that, and a lot of confidence that you'll lose from that. But I also support the adult use cannabis. It's an interesting predicament, especially considering that we are in a recession. So it's going to make sense that there are economic opportunities, but the reality is it does create some ambiguity. What are your thoughts, the Australian panelist team? Any perspective on what adult use cannabis in New Zealand would do to Australia?
Oh, I think it's a step in the right direction if it went through. Obviously, Australia and New Zealand work very closely on a lot of things and follow each other's lead. We speculate this a lot within our business in Australia. We think 5 years here, there'd be at least a discussion about it. I think it's a good thing that you could look at a market like South Africa. They have over-the-counter CBD, legal home grow. I think it's up to 4 plants and a thriving medical market. All three going strong. There's always going to be a place for medical grade cannabis, novel products, and as Mark alluded to, there's so many other ways the plant can be used in healthcare rather than growing a few plants and making your medicine at home. For example, we're currently working on injectables for hospital use. So that's something that's outside of what you could call recreational homegrown medicine, but still could be very powerful for patient treatment moving forward. So there's so many other ways it can be looked at.
Yeah, fair enough. I agree. Warren, any comments or? Huh?
5 years, I reckon.
Yeah, so I think in terms of the bubble, I mean, obviously, it'll just mean that more planes leave the eastern seaboard of Australia and go to New Zealand for a good time. Simple as that. So it'll be an economic value, not just in the dispensaries, but also traveling across you only have to look at Amsterdam and places like that, where there was a geographic location close to the United Kingdom or Europe that people ventured in and out of, that created the tourism for it. But I'm happy that Australia is in the medical market at this time, because we need more water to go under the bridge. We need to get to a lot more understanding, a lot more data. I think the Canadian market is the purest example of how the recreational element, the dispensaries, have really just disintegrated the medical factor of the industry wholeheartedly. While I think that's good for consumers to some extent, it doesn't allow us to get to the point that we need to, and that's identification of symptom treatments based on specific formats, concentrations, and all of that information that we're all building together as a group.
Yeah, I agree. I also think that in Canada, a lot of in Canada is an interesting one, because they've sold like a fraction of the inventory that's available. There's like 90% of the cannabis that was produced still sits in vaults, so it's all just sitting there waiting to be sold with an expiry date pending, so it's not ideal. But I guess my last question, because we've coming up to the hour, is, where do you guys see this in 5 years? What do you think from each of your businesses' perspectives, clinic / distribution, supply, cultivation, and manufacturing? Where do you guys see yourselves in 5 years? Where do you see this industry in 5 years? Warren, you're on screen, mate.
When do I see it 5 minutes after this call? In some elements, I know we've got a crystal ball, and we have this statement internally. See that guy 5 kilometers down the road waving, and we do have crystal ball stuff. But to see where this industry is in 5 years, God knows. I love gambling, but I absolutely have no idea. But in terms of our company in general, this evolution and this wave that you're going through, Guy, you're going to go through, Mark. We're just on that hockey stick trajectory right now. It's been an unbelievable period for us. We've gone through all of the evolutions of licensing, building the facility, and actually, literally right now, we're all considering and looking at our next facility already. So that the understanding and the impetus of where this is going, and also being that first mover and really focusing on that 2.0 downstream formats, means that we've got a long way to run in the next 5 years. But what it looks like 5 years from now, God, anyone can guess.
Good point. Mark, do you want to go next?
Yeah, look, I mean, I share Warren's thoughts there. I mean, a week in this space is like, you know, a month or 2 months anywhere else. It's just amazing. I look back a year ago and think, geez, this seems like about 5 years ago already, you know, so it's remarkable. You know, you like to think you know, we would have continued as a business to get ourselves fully established, continue building the business relationships like we are with other players in other jurisdictions, tech transfers, you know, looking at again, just ways that we can leverage, you know, and create win-win situations and ultimately deliver high quality medicines to patients. And let's face it, if we can start to improve access for patients, and we can start to, as Guy alluded to before, start to hear more and more of these stories of patients actually getting the benefits, and then the full medical fraternity actually accepting that these are real medicines. This is not just people that want to get high from cannabis to feel a little bit better. These are, you know, these are proper therapeutic products. You know, we'd like to see that the you know, the medical establishment has started to embrace these medicines, and that's what I'm hoping for sure.
Yeah, a lot more of what we're doing now. A lot more grey hairs under the hat. Yeah, we're just our goal is just to bring, you know, as much relief as we can to as many patients seeking that. As Warren said, it doesn't work for everybody, but the more we can do, the better. I think there'll be a lot more technology floating around in terms of apps, patient apps, streamlining of that side of things. A lot more data. We'll have a lot more data, so data will drive change. Crystal ball, as Warren said. I think it'll be a lot more streamlined and mainstream. I'd like to see, we would like to see training for junior doctors in their medical training for things like cannabis and psychedelics, other treatments. So they come out of medical school knowing these things. But yeah, I can imagine we'll be talking about legalization by then.
Yep, agreed. 5 years from now, I'm also on that bandwagon. And then my closing statement would be on a completely different topic. As you mentioned, Guy, I honestly believe psychedelics are going to be a complete revolution in mental health, and we're just at the beginning of that industry. So actually, going to be my next season of shows are going to be completely based on psychedelics. So I won't give away too much now, but that's definitely an interest of mine, and I think it's a very important avenue that we start thinking about today, because it is the next wave in this sea of change. But gents, it's been about an hour. I really appreciate each of you taking the time to chat with me. It's been a pleasure. I've got a heap more questions, but I guess it's a part 2 in the near future. So until then, take care. Thank you so much, and it's been an absolute pleasure.
Yep.
Thank you very much, guys.
Thanks, guys. Thanks for your time.
Cheers. Bye.